malty is concerned, I will take a lecture again into the second week in detail when I talk about the bariatric surgery. All of you must know about it that the incidence of PCOD in India is very different than what is there in the rest of the world. WHO said in 2012 there are 12 crores people were there with PCOD. And incidence in world is around 2.5%, while the data from India shows that nearly 35% of adolescent girls have PCOS. I have seen patients who have completed their families and they've gained obesity and they have started presenting with problems of PCOS. So the crux is the key reason for PCOS is obesity. And obesity is known to have wide-ranging impact on the hormonal milieu and consequently result in anovulation, irregular menses, delayed periods, and miscarriage and pregnancy complications. Miscarriage is 3 times what is there in the normal population. So this is, I strongly feel that the key reason for PCOS is obesity. And due to these complications of obesity, a significant proportion of patients present for ART. Obesity impacts folliculogenesis. We are going to talk about IUI in detail, so I will say obesity impacts folliculogenesis, oocyte quality, endometrial receptivity, and in case if she becomes pregnant, the chances of abortion is 3-fold, almost 60%, and the pregnancy complications are plus. Obesity is a disruptor of female fertility. And the presence of visceral fat is the root cause of all cardiovascular diseases associated in obese patients. So the simple rule is, whatever your height is, आपकी कमर आधी होनी चाहिए. I take an example of myself. If I'm 5 feet 4 inches, it means my height is 64 inches. मेरी कमर 32 होनी चाहिए. अगर मेरी कमर 3 इंच भी ज्यादा है, it signifies there is a lot of visceral fat, and visceral fat is the pre-runner of all diseases. Diseases में क्या होता है? There is inflammation, there is a thrombosis, people will have hypertension, people have a dyslipidemia, people will have insulin resistance, and will have type 2 diabetes. PCOD, hypertension, diabetes, type 2 mellitus, fatty liver, dyslipidemia have a common problems. And उसका एक simple सा test है to know that आपकी जो waist है should be half of the height. And very well, very easily done. There is a special test now available. This is called HRP CRP. ये आपका जो टेस्ट है, लाल क्लिनिक वगैरह लोग करते हैं, इसको आपने अगर less than 1 है, then you find that your incidence of having a silent heart attack, silent brain hemorrhage is same as of the population. But if the result is 5, it means you have 5 times more chances of developing silent cardiovascular problem, silent heart attack, or silent brain hemorrhage. Without it, this comes out of the blue. And I find that these days, quite a few of the PCOS patients or obese patients, when I get this test done, I find that the risk is even many patients, and I will say the number is 10%, that it comes to as more than 10. It means के बाद वो beyond करते ही नहीं. इसका मतलब जो भी general population में आपका incidence है, वो आपका 10 times ज़्यादा हो जाएगा. So I think one has to be very clear that you should know about what is the kind of visceral fat you're going to have, because the visceral fat is the root cause of cardiovascular problems. And when these patients are there with you, they require a lot of psychological counseling, that they have to normalize their weight, because that is the cornerstone of the treatment. To obese patient, whenever you talk about reduction of weight to these people, somehow they become very emotional about it. So you have to be very tricky when you counsel such patients. The lifestyle changes, mainly the diet and exercise, can improve the success rate in ART to a significant extent. And I feel even 5% weight loss brings about a lot of changes. And this I call a small changes in weight can show you a large impact as far as the fertility potential is concerned. Insulin sensitizer, to my mind, beside diet and exercise, that is taking a dose of metformin, 500 milligram, also helps. I'm not talking about people, there may be obese patients who are not PCOS patients. There also, I feel, one tablet of 500 milligram along with diet and exercise can help. And bariatric surgery is definitely advocated by the WHO and the Pediatric Fertility, the British Fertility Society in 2007. And they say that severely obese patients and morbidly obese patients, with morbidly obese patient means comorbidities with BMI of 32.5, or without comorbidities, if your BMI is 35 for Indians, they should defer fertility till the time they lose their weight. So they have to work very proactively on obesity. So I think, we will talk in detail about it. This is just, by the way, I just wanted to know that, obesity, you must know about it, that it impacts fertility by folliculogenesis, oocyte quality, and endometrial receptivity. So this is a little bit, and I just wanted to give you a tip about